Thank you so much for joining us for today's science talk. I am absolutely delighted and honored to be your host. My name is Dr. Miriam Axel. And for those of you who are joining us for the first time, we are thrilled to have you here and we hope to welcome you back again in the future. We'd like to let you know that all of our 2024 series, as well as the 2025 series of our science talks, are available online and on our YouTube channel. Our website is www.UNU.EDU/science-talks with an S at the end. Today's talk, like all of our others, will be recorded and the recording will be made available after the talk. We will also conclude with an interactive Q&A session. So please do share your questions for today's speaker in the Q&A box, and I will make sure to read them out to our speaker. And now I am very excited to introduce today's speaker. William Smyth is the public engagement liaison who has experience in advancing the fundamental rights of Indigenous peoples, stakeholder engagement, and community service. He is an active advocate for the interests of marginalized groups. Before joining UNU-INWEH, he worked as a navigator at the Open Door Montreal shelter, assisting primarily Inuit unhoused population and supporting individuals in navigating complex healthcare, judicial, and housing systems. He has Bachelor of Arts in Political Science, English, and Computer Science from McGill University, and he is bilingual in French and English. And with that, it is my great honor and pleasure to turn it over to you, William. Thank you so much.
Thank you so much, Miriam. It's an absolute pleasure and privilege to be here today. For those of you who don't know, these science talks are usually participating in a science talk in the way that I am today is usually limited to our PhD affiliates. So I'm attending here today very humbly, and I hope that I can shed some light on some serious things that are going on here in Canada. So what I'm going to be speaking about today are the different crises that are facing the Canadian Inuit population in the Canadian Arctic. So before we get into it, I just want to give everyone some background on who exactly the Inuit are. So they're an Indigenous circumpolar people, and they primarily live in the Arctic regions of Canada, Greenland, Alaska, and Russia. So Inuit people speak a variety of dialects, but most of these are put under the umbrella term of Inuktitut, though most Inuit in Canada speak English or French very proficiently. Globally, the population is very small. There's only 160,000 Inuit people on planet Earth, and they make up a mere 3.9% of Canada's Indigenous population. And if you'll look at the little map that I have right there in the middle, this represents Inuit-Nunangat. So Inuit-Nunangat signifies where the Inuit live, specifically in Canada. And that's the region that we're going to be focusing on today. So Inuit-Nunangat is huge. It's over 2 million square kilometers, and this accounts for 35% of Canada's land mass and 50% of its coastline. Inuit are represented on the international stage by the Inuit Circumpolar Council, and this council convenes and is based in Anadyr, Russia. So you might be wondering why I, of all people, am here speaking today about the Inuit. So I'll give you a little bit of background on that as well before we start. So like Miriam mentioned, I used to work at the Open Door Montreal shelter, which is a 24/7 emergency shelter which prioritizes the unique needs of Indigenous people. Inuit people are very overrepresented and make up the majority of the community that I used to serve, and that the heroes that still work at Open Door today are continuing to serve. So like Miriam also mentioned, I used to work there as an Indigenous navigator, and what that role primarily entails is accompaniment. So we see that with Indigenous populations and communities, down to the individual level, there's a fundamental mistrust, often a fear of the system due to historical reasons. So I spend most of my time as a navigator, and that means accompanying people through the system. So going with them to the hospital if there's an emergency, going with them to medical appointments at the hospital, accompanying them to court, to probation appointments, to introductory meetings for subsidized housing applications. So that was the bulk of my work at the Open Door. And you might be wondering why exactly there are so many Inuit in Montreal. And the reason why is because, and I'll touch more on this later, the health and water infrastructure is not up to decent standards, we should say, up in the Arctic. So often, if there's a serious health condition that requires long-term treatment, or if there's an emergency surgery that's needed, oftentimes Inuit people will be flown down from the Arctic regions of Canada and come to Montreal, which has a lot more sophisticated and advanced medical services. Oftentimes, Inuit will end up on the streets because there's some difficulty sometimes adapting to the city life, which can come as a culture shock. And also, there's a very well-established Inuit community that people feel welcome and they join. And the access to services in big cities is also very attractive. But oftentimes, unfortunately, this will cause them to be in a situation where they find themselves unhoused. So over the course of this experience, I really became interested in what exactly is going on in the Arctic. Why are systems failing up there? And what are the impacts on Inuit? So last week on Friday, I'm trying not to tear up. I attended a memorial for some community members that recently passed away. And this really lit a fire under me. And this is why I want to give a great talk today. But unfortunately, the Inuit that find themselves unhoused in Montreal will pass away at disproportionate rates. So this event was the first in a year and a half. Unfortunately, we have these memorials way too often in the community. And it was to commemorate 28 people who had died on the streets, most of which were Inuit. So I could talk on and on about the situation that's going on in Montreal, where I worked for a year, but my primary focus today is more going to be on the Arctic. So let's talk about that. To understand what's really going on, we need to look at the Inuit-Nunangat region, and we need to analyze the different crises that are going on up there, specifically with regards to water, environment, and health. So I'm just going to give a content warning for this next part. There will be discussion of suicide. So I'm just going to carry on in a second. And yeah. So these are just some statistics about the Inuit living in Inuit-Nunangat, which again is the Canadian Inuit territory. And these statistics are pretty alarming to say the least. So the life expectancy for the average Inuit male is 64 years, whereas the national average is 79 years. Further, in a relatively less extreme way, the life expectancy for Inuit women is 73 years, which is 10 years less than the Canadian national average. Next, we see on the right that the poverty rate in Inuit-Nunangat is 17% higher than the Canadian poverty rate. I wish it ended there, but it does not. 40% of Inuit live in overcrowded homes. And that is just the highest rate in Canada of any demographic. Further, the malnutrition rate is 500% that of the national average. And again, in 2023, at some point in time, 80% of Inuit in Inuit-Nunangat lived under a boil water advisory. So what that means is in the morning, you turn on your radio and you listen to see if you need to boil your water that day, if it to see if it's safe to drink and and to use. And this can be due to a lot of different reasons, and I'll delve into that a bit later. Um, Furthermore, we see that the infant mortality rate is twice as high in Inuit Nunangat as well. And lastly, um, so the suicide rate is a big alarming issue. Um, and we see that it's 39 times higher than the national average. And as we observe across cultures, across countries, um, men are particularly impacted by this. A study showed that women who attempted suicide used far less lethal means and were thus less less successful in their attempts, whereas men used more lethal means such as firearms. Um, and wrapping your head around this can be very difficult, and there's no proper way to explain it. But the rest of this presentation is going to contextualize a bit what life is like for Inuit living in Inuit Nunangat. So now we have a little bit better of an understanding of the statistics. Um, And basically, my thesis for this presentation is that water is at the root of many of these issues. And it's very fitting that I work at the United Nations University Institute for Water, Environment, and Health. I feel like this is very relevant to our mandate and to what we do. So I want to present a microcosm for all of the statistics that I just presented. They can be very well summed up in a recent crisis that happened earlier this year in Puvilnituk, Quebec. So this is a remote community in northern Quebec. Most Inuit communities are very remote. So this has Puvilnituk has a population of 2,000 people, and it gets extremely cold. So what happened was um, most structures in Inuit communities, particularly Puvilnituk, depend on a trucked water system. So most houses have a water tank that is filled up by a truck every so often. And that truck is supplied by a pipeline, which has an access point of usually a few kilometers away from the community. So what happened was in the extremely low temperatures, the water in the pipe froze and it blocked the water from coming through. And they essentially had a complete and total water shortage for a matter of months. So this infrastructure, which is already eroding, could not withstand the extreme cold. So to add insult to injury, 2 out of the 5 trucks that supply Puvilnituk were out of order. So the very little water they could get, they couldn't get it efficiently enough to the community. And the worst part is a lot of Inuit depend on the trucking system for employment. A lot of Inuit in these communities are truckers. And the situation got so bad that water had to be flown in by plane from the south. And now I'm going to talk about the health center in Puvilnituk, because the same pipeline that supplies the truck directly supplied the hospital. So over the course of like so many weeks, there wasn't basically any water coming in until the plane shipments came in. So the hospital had to shut down for days on end, sporadically, and it was a hospital without water. So what happens inside of a hospital without water? Well, healthcare professionals, they have to improvise. So there's a bunch of testimonials that I found from this crisis from healthcare professionals. This first one is from a midwife. So when women give birth, usually they have to be cleaned, but this time around they had to use water bottles to clean to bathe people who gave birth. So it's just very alarming because usually there would be a proper bath. And then there was also a testimonial about a doctor who was performing surgeries. So if he was doing an invasive surgery and his glove breaks, he gets blood on his hands, he can't wash it with water. There's no running water in the hospital. He had to use hand sanitizer um, in order to wash his hands, which doesn't necessarily clean out all of the pathogens that could be on the blood. So it was not only was it not only did it interfere with medical practice, it was also a public health issue. And then on morale, when these kinds of situations happen, too much is asked of healthcare professionals. And there's a very high turnover rate for healthcare professionals in the Arctic because they usually come from the south. And the turnover rate and the shortage is already pretty considerable without these kinds of crises happening. But then you have a situation where the hospital doesn't get any water. So that put further strain on the healthcare system in Puvilnituk. And that takes me back to Montreal and talking about the community that I worked with. When these situations happen, patients have to be flown to the south. There's basically no choice. And I'm not going to get into, whether or not that's a good or bad thing, if people stay in the south or not. That's everyone's individual choice. But it can put people in very difficult situations. Then again, that's not the exact focus of my presentation. Maybe it'll be the focus of my next one. But I'm going to continue to talk about what's going on in Inuit-Nunangat. Another pressing issue is tuberculosis. So tuberculosis, at least where I am in Toronto, it's not something people talk about. It's not something people have to worry about. But in Inuit communities, unfortunately, it is. So tuberculosis, or TB, it's an infectious disease, and it's spread through a bacteria in spit particles, when someone talks, sings, coughs, etc. And this is when it's contagious when it's active. So there can also be latent tuberculosis, which is where someone is infected, but they're not contagious and they're asymptomatic. But when cases do get extreme, you have situations where people's lungs and airways are completely compromised. And it's not a good situation at all. So in 2023, the Canadian government publishes a finding, and it says that the tuberculosis rate in Inuit-Nunangat is 37 times higher than the national average. And that's very concerning because tuberculosis is relatively often a fatal condition. But why are the rates so elevated in Inuit-Nunangat for tuberculosis? So tuberculosis has a long history in Inuit populations. So if there are latent cases that are not examined, that are not discovered, that are not treated, then they can eventually become active, and there can be a very intense spread of the virus. Like I said, there are all these barriers to healthcare access. There's strain on the system. Like I said, also Inuit have a mistrust of the system. So if they feel sick, they may not go seek help from a Western medicine service. And then chronic food insecurity is a big problem, because if a case of tuberculosis is latent in somebody, the malnutrition that comes with that can weaken the person's immune system and make a tuberculosis case active. And when it's active, you're symptomatic and you're contagious. And lastly, and most importantly, Inuit live in very overcrowded homes. So I've heard testimonials of people that I used to work with that they were living in a 4-person, 3-bedroom home with 17 other people. So when you have all these people in a small space together, then it becomes a hotbed for tuberculosis transmission. So I want to focus a bit more on overcrowded homes And I'm going to do that through a case study of Nunavut. So Nunavut is one of Canada's 3 territories. It's the largest, and it has the biggest population of Inuit in Canada of any province or territory. Um, and it has a population of around 41,000 people. So I just want to give you a visual example of the kinds of situations that people are dealing with regards to overcrowding. So if you see the little wooden structure on the photo, that is an extension of a small house, and 3 people sleep in this small wooden box essentially because there's not enough space for other people in the house. And it's not something that's spoken about a lot, but there's also a lot of homelessness in these communities. There are people who live in tents in their own communities because the housing infrastructure isn't developed. And I'll talk a bit more about that in a second. And just going back to the statistic that I mentioned earlier, 40% of Inuit and Inuit-Nunangat live in overcrowded homes. So let's talk about the infrastructure in Nunavut a bit. So a 2020 report, so 5 years ago, this report comes out and it says that most of Nunavut's infrastructure, period, is either expired, as in it's past its lifespan, it's no longer useful, it's no longer safe to use, or it's very close to approaching the end of its lifespan. And this was 5 years ago. And looking into Nunavut, I haven't seen too much development on that front, which is concerning. So this includes the services that at least I take for granted every day. Electricity, water pipes, health centers, sewage, etc. And so most of this infrastructure was built up to 50 years ago. And that might not sound like a very long time, but if you consider the very harsh weather conditions, then you might come to understand why infrastructure erosion is very much accelerated in Inuit-Nunangat. So we're going to talk about the capital of Nunavut, which is Iqaluit. And Iqaluit has been facing a lot of different issues, overcrowding being one of them. So in an interview with the former deputy mayor of Iqaluit, she was asked about overcrowding in Iqaluit and how it can be addressed. So she framed it in a way that overcrowding and the water access and water scarcity and water infrastructure erosion issue is inextricable from the overcrowding issue. So when you have eroding infrastructure that's way past its expiration, you can't extend it to create new homes. You can't add new pipes to homes. You can't connect it to the sewage system. You just can't expand the city. And with a very high birth rate in Inuit-Nunangat, that gets very concerning because if we don't replace this infrastructure, where are all the people going to go? And I read another report about Iqaluit, and it essentially said that they would need $100 million to rebuild and revamp just all of the water infrastructure alone. So very concerning. Overcrowding, like I said, it'll exacerbate the spread of tuberculosis. It'll and it's also exacerbated by the water infrastructure issue. So additionally, industry can't expand. Without the proper infrastructure, how are you going to develop a region economically? So as I mentioned, the poverty rates in Inuit-Nunangat extremely elevated. 22.5%, which is 17% higher than the national average. So you can't industrialize, and you can't expand medical infrastructure either. So just to conclude, these issues all demand further research and intervention. when it comes to having a seat at the table in conversations about Indigenous water access, Inuit are often Inuit voices are often not at the forefront of the conversation, given that they only make up 3.9% of Canada's Indigenous population. Um, and there are certain benefits that, for instance, the First Nation people receive that Inuit don't receive. For instance, First Nations don't need to pay taxes, whereas Inuit do, despite the extremely high and concerning poverty rates. So when I was talking to two of my colleagues, Dr. Abraham Nunbogu and Professor Grace Oluwasanya a few months ago about these issues, they told me that the first good step towards improving this situation from a research perspective would be to do a systematic review of the existing literature and work that exists on this topic so that we can figure out what we know and what we don't know so we can determine the best approaches to improving the situation. And that said, there are also a number of pillars of IQ, which is Inuit traditional knowledge. And it's imperative that these be included in conversations about improving the situation in Inuit Nunangat. So there's respecting others, relationships and caring for people, fostering good spirit by being open, welcoming, and inclusive, serving and providing for family and or community, decision-making through discussion and consensus, development of skills through observation, mentoring, practice, and effort, working together for a common cause, being innovative and resourceful, respect and care for the land, animals, and environment. Um, and I think sometimes researchers might be hesitant to incorporate traditional frameworks into their work. Um, and I think that they would go together very well, actually. So Narkumik, thank you very much. It was a pleasure to speak today. Thank you.
Thank you so much. That was really wonderful, and I really appreciate the depth and breadth that you brought to such an important and difficult topic. You have a number of questions in the Q&A chat, so I will
Okay.
start with the first one. Maria Schechter asks, what was your most memorable moment at the open door?
When I left to come work here, um, everyone, the community members, my coworkers threw me a barbecue. Um, and it was a beautiful moment where everyone came together and everything felt all right for a moment. Um, I miss my team a lot there. They're great people. They're keeping people alive um, and saving people's lives every single day. So yeah, I would say that was definitely a highlight.
I think you bring a lot of that spirit with you, and it's clear that they're here and attending and supporting you. You have another question. What a great talk. Selena says, I was wondering what your favorite part about working at the shelter was, which you just said. And have you been to Nunavut before?
I have never been to Nunavut. No, I would love to go, and that's why I kind of feel like an imposter talking about this because I've never visited any of the communities that I spoke about today. But I would love to one day, of course.
You have other
Thank you, Selena.
questions. Um, thank you for this important and engaging talk. What led to your interest in this important subject? Was there a particular moment or experience that sparked your interest in these interconnected challenges?
I think, I started working um, at the Open Door after being a volunteer. I thought it would be a summer job, but it kind of turned into a vocation, not to sound corny or anything, but it was a really good time. And I got very close to the community there. So I think, addressing these issues could eventually improve the lives of the people that I met and connected with there. So I think that's what sparked my interest in in this subject and why I felt the need to talk about it today.
Are there any particular sources or voices that have influenced your thinking or your direction in researching this?
Um, that's a really good question. I think the community, the whole community at the open door. That I don't know if that's a proper answer for you, but yeah, just getting to know, especially the Inuit community. There was so much I didn't know before, and at the open door, it wasn't all about individuals. It was about the community feel. We felt like we were together. We were one. Um, Times got tough sometimes, but um, I think that I would just have to thank the community for that. Yeah.
And for someone very new to this topic or this area, what's one thing you wish people understood right away?
Um, I think there's a lot of stigma around the problems that Indigenous people face. I think some people tend to blame them. Some people might say that they should try harder to improve their own situation. Um, and I think that if you're going to explore this topic, that's something you should know right off the bat. Good question. Good question.
And Alexandra asked, what are effective ways to support Indigenous communities within Toronto and the Greater Toronto Area?
That's a really good question. I mean, the Indigenous, well, if we're talking about unhoused Indigenous communities specifically, um, the situation isn't necessarily as obvious as it is in, say, Montreal. But there are a number of services that cater to Indigenous people. I think it's a systemic problem that appears everywhere throughout Canada. And I think, unfortunately, if you go to any homeless center in Toronto, you'll encounter some Indigenous people. So I think I'm not aware um, of any services in Toronto that specifically cater to Indigenous people, but I know that it's Indigenous homelessness is still a big issue here. Maybe not um, as big as in Montreal, but I think volunteer at a shelter. It's not hard to do. They always need people. Don't just volunteer around Christmas time though, because everyone does it around Christmas time, and they find themselves in a situation where they actually have too many volunteers. So sometime in July or something, volunteer at your local shelter.
That's a really good lead into the next question that you have. They say, thank you very much, William. This was a very informative talk. So glad I was able to join this and I've learned a lot. What are some things that we as civilians can do to help?
We as civilians, well, like I said, if we're talking specifically about the situation um, that's faced by Inuit people, it's not something that's very well known. Um, it's the focus on First Nations is very important, obviously, but there should be a balance with the issues that Inuit people face as well, because um, some people don't even know that they exist or that they're a distinct group from the First Nations, which they very much are legally. Um, so I think spreading awareness, talking about it, um, would be a great start.
An excellent lead into the next question, which is from Marcos. He says, where can people go to get informed on the current state of Inuit communities and or Indigenous communities across Turtle Island? The open door misses you and our community loves you.
I think obviously we live in the internet era. Um, a lot of learning opportunities there. There actually is quite a bit of documentation online. Um, and I think go to your local um, go to your local shelter. Ask these questions. Talk to academics um, who are savvy on the subject. Um, Stop by the open door. that would be a great start too.
I think you touched a little bit on some of your most memorable moments at the Open Door, but I'm wondering what first got you there, and if you could talk us through a little bit about your first day there and what that experience was like.
It was pretty overwhelming. I mean, I'm a pretty privileged guy, so um, I wasn't accustomed to that type of environment. But I think I adapted pretty quick. I think it was just a little bit overwhelming. It can get chaotic sometimes. But it's a great place where everyone is respected and everyone is respectful to each other. It's a great team. It's a great community. The team really cares about the community. That was the first impression that I got. And I think there's something really special going on there. If you're going to compare it to other shelters, I don't think any of them have the same vibe that the Open Door does.
Yeah, thanks, William. A very nice and engaging presentation, and your passion about these things is the most important things towards the presentation. So when you talk to those indigenous Inuit people that you met, so what do they expect from us or from the government? Like one part is making them smooth accommodation and in the shelter when it comes to the city or in Montreal or Toronto, whatever it is. But that's not the ideal case. So it's best thing that is they get the support in their community at home. So what their expectation, and they think the problem should be addressed. For example, the water problem or health issues, and what is their expectation on those things, and also how traditionally they used to address those things before, like this high water, those kind of things were there.
Okay, so you have a very multi-pronged question, Mateen. Thank you. From what I understand, your first part of the question is, what's the expectation? What exactly do Inuit people want on an immediate basis or on a long-term basis?
No, in the long term.
On a long-term basis, I think those that are living in the communities that I spoke about today, I think they just want attention. They look, I can't speak for Indigenous people. I'm not Indigenous, but I think that I've heard a lot of cries for help. And that can be very systematic as well. So I think they might feel neglected on a lot of these issues. As a white person, I've been told off. It was harder to get some people to trust me. But eventually they did, and I'm very grateful for their trust. I think, for example, what Mark Carney is doing right now, I think is good. At least in spirit, he's gone to the Arctic. He said, we're going to develop it. He has put First Nations people at the forefront of the discussion about water and health issues, and he said he would let them set the agenda on that. I think it's just a matter of throwing resources at some of these issues. That's really what it boils down to. So yeah, on a long-term basis, it would just be being afforded the attention and respect that any human being deserves. And then when you also asked a question about the traditional practices for healing.
Yeah.
I'm not too savvy on that subject. I'm not going to lie. I know that traditionally, Inuit were shamanists. So I think there was a lot of spiritual healing. I don't know about the prevalence of shamanism right now, but traditionally it was very prevalent in Inuit communities. So I think spiritual healing was at the forefront of that.
Thank you.
Thank you.
Did I answer your question properly, Mateen?
Yeah.
Thank you.
We need to investigate more.
Absolutely.
Hi, William.
Irene.
Well, thank you for this very informative presentation that highlighted the vulnerability of Inuit indigenous people, which actually expected to even contribute to hindering the attaining the sustainable development goal when it comes to leaving no one behind. So thank you. My maybe it's a question. It's about how do you think that we can integrate the knowledge of the Inuit people within the framework of the policy within Canada, and even with an institute that would like to help in this regard?
I think most importantly, you need to give Indigenous people a seat at the table. So let them be part of these discussions instead of taking a list of values, traditional values that Indigenous people hold dear. You would actually need to involve Indigenous people in these conversations at a very high level.
Thank you.
Thank you.
I think that's a wonderful question, and it leads very well into another question that you have in the chat about what parallels do you see between Open Door and your current role, and how have the skills that you harness from Open Door, how do those inspire your work today?
I think through my time at Open Door, you know, I getting close to the Inuit community, I researched a lot of the topics that I spoke about today. And, you know, we talk about global North and global South, this, I think, outdated dichotomy that kind of generalizes each nation without looking at different pockets within the nations. But I think the issues that have come to light to me that I've learned are also very much present in the regions that we at UNU-INWEH are focused on. In Africa, water access is a big problem. Giving Indigenous people a seat at the table is also a big problem. So I think my work at the Open Door was a lot more direct and hands-on, boots on the ground. Whereas here, I know that, you know, the harder I work, the more I'm supporting the efforts of very important and influential change makers who can get things done on a global scale, if that makes sense.
Thank you.
Thanks, William, for a really fantastic presentation. You know, as a public health guy, I really appreciated your focusing in on the TB epidemic that is taking place in the communities in Canada, and the systems perspective that you brought to it as well, really bringing in housing and I guess I was wondering, in terms of Inuit-led approaches for addressing some of these TB challenges, do you know of any programs or interventions or approaches that are working or that have been attempted, or ideas around what needs to be done in terms of Inuit-led approaches to TB?
I think that's a really good question. In terms of direct approaches and initiatives, I don't know, I can't specifically speak on that, but I think I would revert back to my point about giving Inuit a seat at the table for any of these, water and health discussions. Because as we know, the lack of proper water infrastructure is going to hinder the expansion of housing in communities, which just exacerbates overcrowding. It exacerbates the economic issues, which engender malnutrition, which can also activate TB within someone's system. So I think without expanding the water, housing, and health infrastructure, which is what Inuit people have been demanding and crying out for help for, you're not going to have any. I don't think you're going to have any meaningful initiative on addressing TB, because it's not going to be prevented without the proper healthcare, etc. If that makes sense.
Yeah, great answer. And Canada has led on the establishment of a program with the Stop TB partnership called the TB Reach Facility. And that mechanism was established to look at innovative mechanisms for kind of improving case detection around the world. So it's a fund that has been established to kind of test different locally led solutions for improving case detection. And that might be something that we can look at if you're interested.
That's awesome. That's awesome. Yeah. Thank you. Because I know like in India as well, TB is a big problem. It's a global problem. In Canada, you really only see it in Indigenous, especially Inuit communities. So yeah, it's a I think it's something that we could definitely work on. Of course. Thank you for letting me know. I wasn't aware of that. Thank you.
Definitely one of the leading causes of death in the world today still.
Really?
Yeah.
Wow. I did not know that.
I just want to add that it's not just the Inuit, but most northern Indigenous communities are experiencing for the last 3 years, have been experiencing a lot of TB cases which are unaccounted for. And one of the one of the reasons why Canada or there's not much focus or attention in addressing these issues is because in most of these communities or most of these we serve, the management is done by the bank themselves, especially those self-governing ones. Most of them feel this, whatever infrastructure or whatever funding to address this issue is being channeled to the bank. And the bank or the First Nations bank do not put priority or focus on these issues. And so that's, I think, something that we can shall we say, put into focus and bring to the attention of everybody. Because as you said, Canada is known for the whole, it's known in the whole world to be addressing this. Canada has provided a lot of funding to the Global Fund, which focuses on these kinds of issues. But Canada itself, in the northern communities, the Indigenous communities, they have not really addressed any of these issues. Even now that there's still a lot, and I know for sure Northern Manitoba,
Yeah.
the Northern Manitoba, Nunavut, uh, Northwest Territories, the upper, and even as far, in Ontario, I know Northern Ontario, the area of Thunder Bay, that area there, they have northern communities who are experiencing this kind of health issues, but there's no one to help.
And I think, yeah, it falls into, I think status is a big problem. The recognition um, of rights, and also, there are also different tiers within the Indigenous community of like I was talking about earlier, whose voice is heard first, whose voice is the loudest. And there's no problem with any particular Indigenous group having a louder voice. I think it's just that everyone, all the community's voices should be equally heard. And Imelda, yeah, you're completely right about how there are all these issues that are also ongoing with the ones that are maybe at the forefront of the conversation, but that aren't really too topical for people or things that people are interested in talking about.
Okay, following on that, thank you so much for the wonderful presentation. And I know that Indigenous people are highly marginalized. They face high rates of incarcerations. But in most public events, we only make land acknowledgements. So do you think we are doing enough to address these issues? Or we only acknowledge the fact that, yes, we took lands from Indigenous people? And working with these people, how do they feel? Maybe you'll be the best person to tell. How do they feel when they are making these land acknowledgements without highlighting the other issues they are facing?
That's a really good question. I've never spoken to an Indigenous person about land acknowledgements. All I can really do in that regard is regurgitate some of the common critiques, so that it's very scripted, it's robotic, it's repeated. Oftentimes the names of the Indigenous communities or people are like really badly mispronounced. So it's a box to tick. I think it's safe to say that, maybe when it first became a thing, that it was well intended, it was well spirited, but I've seen a few, very botched land acknowledgements where people kind of just seem to be doing it to tick a box. Does that answer your question? Because I've never spoken to an Indigenous person about the typical script for land acknowledgements and how they feel. But I'm sure that there are very mixed feelings about it. I think it's safe to say.
Thank you.
Thank you, Abraham.
Yeah, William, I know you and I have discussed a lot about this, and you know where my heart is in all this. So I would say again, keep doing what you're doing, because information is key. I have this mantra, numbers don't lie, but if you don't have the numbers, what do you do? So that works here. If people don't know, people will only react to what they know. So keep talking about it. But pretty much, I guess the call for action, can be anchored on what Rick said, leave no one behind. So long as we're all red-blooded. This morning I knew I was telling you that if you slash my wrist, regardless of the fact that I'm brown skin, it is red blood that will come out, not a green blood, and ditto any human beings. So long as we wear the cap, humans, then we deserve a voice, we deserve a seat. I believe it's not the way you've been positioned right now to be their voice is great, but you can do more. We can do more. So it's call, to action to keep pushing this forward, more research into this, to really give it, proper framing, and also keep calling on people. You mentioned a figure, in about $100 million, you say. I
Yeah.
believe, some form of crowdsourcing. This is where it's at, So I hope people that can run with it are listening to this science talk, or will eventually go and watch this particular episode on demand, because it's available. That people could really rally. Those who said, what can civilians do? I believe there's so many things we can do. We don't have the money to give. You can keep talking about it, passing on the information. And if you're in the position to crowdfund, please all the way go crowdfund, get the people themselves involved, because it just dampened my spirit, that in the midst of plenty. So it's like, these people are in the midst of plenty, and somehow, they're just not. I mean, it's a gory story that I don't want to repeat, but that's a lived experience of some people here in Canada. I mean,
Yeah.
it's, so let's do what we can. Thank you.
Yeah, thank you. No, everyone, Grace has been so encouraging to me. She's been she's been one of my biggest supporters. I really appreciate Grace. And yeah, like you said, I think the numbers I presented today are essentially the extent, or a good way there to the extent of what we know about these issues. There's so much we don't know. There's such little research or efforts to conduct research about this. And without the research, there's no way you know how to address these things. And I think, yeah, like you said, like your average person might feel helpless in the wake of, I mean, everything that's going on in the world, but even this issue, you might feel helpless, you might feel powerless as an external observer. I think the best place to start is just get informed. I think I've had so many great conversations with people in the office about this topic. And, not everyone in the office comes from Canada, so they might not be aware of these things. And just to be able to, me as a guy who just got his bachelor's, to be sharing these stories with PhDs and actually teaching someone with a PhD something is just insane. And I think, word of mouth, like one person to the next, one person to the next. And it can spread like wildfire, and it can actually make a real impact, just knowing something. Knowledge is power. That's pretty corny, but it's true. So yeah, thank you, Grace.
William, thank you so much for a wonderful talk. I know that this wasn't an easy subject to discuss. I think you really shed a lot of light on very important issues, and I think these are the kinds of conversations that are going to continue beyond this. Thank you so much for your time, your passion, the amazing work that you're doing. It's obvious also that a lot of your colleagues from the Open Door really miss you, and you had a great impact there. Keep fighting the good fight. And thank you so much to all of our viewers who joined us today. We look forward to seeing you again next week. Thank you very much.
Thank you so much. Thank you, Miriam. Thank you, everyone that joined as well. Have a good one. Thank you so much.